Welcome to video series on acid-base balance. This video is on arterial analysis. Now, why this ABG analysis is needed? Now, this is needed to diagnose the type of acid-base disorder, to identify whether the acid-base disorder is a compensated or uncompensated one, and the last thing is to monitor response to treatment. What are the components of arterial blood gas analysis? These includes pH, bicarbonate, partial pressure of carbon dioxide, partial pressure of oxygen, and oxygen saturation. Now coming to selection of container. Most syringes are pre-packed with small amount of heparin. This is mainly done to prevent blood coagulation. If other syringes are used, they have to be heparinized by drawing a small amount of liquid heparin and squirting it out again to remove the air bubbles. Now coming to selection of artery, the most commonly used is radial artery. If this is not visible, femoral artery can be used. Radial artery is preferred because it is easily accessible, can be compressed to control bleeding, and less risk for vascular occlusion. But we need to perform Allen's test to decide which radial artery to draw the blood. So the Allen's test procedure is as follows. Now patient is asked to make a fist, and both the radial and the ulnar artery are compressed by placing the thumb of the examiner or the conductor. Now and this is released one after the other, so that to see how quickly the color returns to palm. Ideally this is 5 to 15 seconds. So if the color returns to the palm, this indicates adequate collateral circulation, and the radial artery can be punctured to draw the blood. So if there is a delay femoral artery has to be used for drawing the for collection of blood sample for analysis. Next part is transportation to lab. If plastic blood gas syringe is used, then the sample should be transported and analyzed within 30 minutes of collection of blood sample. If there is a delay, the sample has to be collected in glass syringe and has to be placed on ice and then sent to lab. So this is the procedure for blood sample collection for ABG analysis. First Allen's test is done, and if the collateral circulation is established, so then the radial artery part is is made sterile. Then the syringe is inserted into the radial artery. So blood starts flowing into the syringe. Then the artery is occluded to prevent further blood loss. So the syringe is tapped to remove any air bubbles. It is capped and sent to lab, and this is the instrument for ABG analysis. So this was about ABG analysis. Thank you. Next video will be on ABG lab report interpretation. Please do like, share and subscribe. Thank you.